This was the price I paid for not eating during my pregnancy. Who can guess what I'm going to be talking about today? All right, I think you have not gotten it. So I'm going to be sharing to you a little secret of what I did. This is Talk Pregnancy with Dr. Nola, where we tell you all about pregnancy and other women related health issues. If these are the kind of contents you like to watch, please click on that subscription button. And I think you will not want to miss out on this particular video. Let's go. A lot of you now will be saying, these girls, you didn't eat throughout your pregnancy. I know this is what's coming into your mind. I want to tell you what happened. My first pregnancy was a cesarean section. And in order to get a vaginal delivery, that's a normal delivery, after a cesarean section, then there are some conditions that you have to fulfill before you have a vaginal delivery. And there are over 10 of these conditions that you have to fulfill, all the 10 conditions, before you are even given the opportunity to have vaginal delivery after a cesarean section. Now, you might be asking, what are some of these conditions? How can you manage it? If you're out there, you've had a cesarean section before, or you've had some birth complications which could have been prevented, then this is the right video for you. If you've had a cesarean section before and you plan to have a normal or a vaginal delivery after this cesarean section, then this video is definitely for you, because there are some things that you can do in order to prevent yourself from having a cesarean section, because every cesarean section definitely has an indication. There is a reason for carrying out a cesarean section, and there are some ones that are within your power that you can work on, but there are other ones that are above your power, which you can change, which you can't do anything about. It happens, it just happens. Before you have a cesarean section, there are many conditions which could be either from the mother's side or from the baby. From the mother, it could be maybe the mother has a pathology or a medical condition which this pregnancy is aggravating it. So maybe they have to remove the baby as early as possible to save this woman. Secondly, she might be exhausted or tired from pushing. She might have also a problem with her pelvis, especially people who have contracted pelvis. There are people whose pelvis are contracted, thus they can't expand, it won't expand properly well during delivery for the baby to come out. So these conditions are there. You might also be having a life-threatening condition and they have to save you at that point. Therefore, removing the baby at that moment will save your life. Now, when it comes to the baby, it's maybe the baby is suffering. That's the first thing and the most common. The baby is suffering, the baby is not breathing well. Then they have to remove this baby as fast as possible. And trying to navigate through the birth canal, through the vagina, it might be difficult and it might take time and this baby might die. So you have to undergo a cesarean section at that time. Secondly, maybe there might be severe malformations and the baby might not be able to go through a normal delivery, and they program you for a cesarean section. There might be other problems like the cord is round the neck and the baby is suffering, or the cord, there's what we call cord prolapse, where the cord has gone in front, the cervix, above the head, passing first before the head is even coming. There are also times that the baby might be too big, baby might be difficult to pass through the birth canal without having a complication, so they might program you for a cesarean section. At times too, the baby might not be coming with the right position. All these can lead to a cesarean section. Now you're someone who has had a cesarean section before and you plan to have a vaginal delivery and you hope that next time you have a vaginal delivery, this is what you can do, because there are 10 conditions. The first, we are talking about the mother side, and then the baby side. For the mother, it should not be at the same recurrent indication. If you have a contracted pelvis, your pelvis is already small, so that one can not longer be changed. If you've had two cesarean sections before, the next delivery should be a cesarean section. If you get pregnant within less than 1 year from your previous pregnancy, then you will be operated upon, because the wound has not healed properly to undergo another contraction. When it comes to the baby, if your baby is big, more than 3.5 kilograms, then you have a chance of going through another cesarean section. If it's twins, if it's triplets, it's quadruplets, they cannot even try. You have to undergo a cesarean section. If the baby does not position the self well, so if the baby is not coming with the head down, then it's another cesarean section. Remember, we know that during delivery, any other thing can change, because during delivery, the baby might still suffer. Those things are the ones that we cannot control. But before a doctor has to leave you that try and undergo a normal vaginal delivery, you should have fulfilled all these conditions. So these are some of the conditions. And with all this, once you've had this condition, what can happen? There are only two conditions which you can control yourself. There are two, only two. And the first is you can control what you eat, and you can control the size, the weight of your baby. I'm going to talk more on that. And the second is the spacing in between. If you've been operated before and you get pregnant when it's not yet 1 year, when your baby was delivered by the cesarean section is not yet up to 1 year old, and you are already pregnant, then the doctor will not even leave you to undergo a vaginal delivery for contractions to start. They will just program your operations and operate you for the second time. And once you've been operated second time, that's all. You can't be operated. Even though some other places, like in Western countries, they can try two scars, but we don't usually advise that. So you can control the time that you can take in for the next pregnancy. That's what you can control. And then now this comes to our topic of today: what you eat. It can control the weight of the baby. Many people feel if my baby is fat, the baby is healthy. No, no, no. Remember, there is also obesity in children, there's obesity in childhood. And with this weight, the baby also has a high risk of having other complications. The baby has a high risk of developing hypoglycemia, and in the long run develop diabetes. So if you're eating a lot, it can also affect your health. It can increase your chances of having hypertension, diabetes. So you have to control your meals. When I was pregnant, I had to control my meals a lot. I knew each thing that was entering my mouth. I knew whatever I was eating, just eat anything. If I had to eat some things in between, I knew that I had to take fruits, vegetables, and drink enough water. So those were the things I was taking. I ate my 3 square meals. I ate the 3 square meals moderately enough, when I make sure that once I don't eat till satiety. Remember that pregnancy hormone increases your appetite. Like, so you just see a woman who is pregnant and she just, oh honey, my husband, can you bring me this, can you do this, can you bring me this, I want to eat some spicy food, I want to eat chicken, I want to eat fish. So you just keep on eating all these things randomly at any time, at any moment. Even eating those things, even at the timing, it's also important, because as you're pregnant, it increases your chance of having gastritis. So once you eat that, eating late to increases those things, and it leads to discomfort more. So you have to, anyone, even you have not had a cesarean section before, it's important that during pregnancy you have the normal weight that you have to gain during pregnancy, but don't eat anything at any time. Control your meals. Eat your 3 square meals, and in between you drink water, you take fruits, fruit juice, enough natural juice, take vegetables and nuts. You can eat nuts as well. So these were the things that I was eating. So I didn't just eat anything once when I was pregnant. And it helped me control the weight of my babies as well. So with the two pregnancies that I had after the cesarean section, I delivered them vaginally because the weight too were okay, and thank God too we had no complications, even though there were some complications with the last one where she had some difficulties breathing, but luckily for her, her weight too was okay. And if she was a little bit big, if the weight was really big, it could have led to another cesarean section. So that saved me. That was the lesson I learned. The biggest lesson I learned was it helped me during that time of labor. During labor too, you see when the baby is big, it's going to cause difficulties in labor. The baby might come out too with the shoulder having a problem. There's what we call shoulder dystocia, where the shoulder gets hooked at the pelvis and it has to be compressed before it's sent out. And by the time you're compressing, it might compress some nerves there. So you, by the time you are pregnant, please control what you eat. I hope that this was helpful, please, and you share this to all women out there to help them once they are pregnant to follow up their meals while pregnant. And don't forget to subscribe. And if you want to have a one-on-one consultation with me, you can click on the link below. You can join our community where we talk more about pregnancy. We follow up your pregnancy as well and other women related health issues. So you can join our community there too. Thank you very much and God bless you. Bye.